Hi, I'm Dr. Elizabeth Harris. I'm a board-certified plastic surgeon. Many patients present to me that are concerned about the appearance of their face, and they're unhappy with the lines and some of the aging that they're seeing. Even though I do many facelifts, I'm finding more and more patients are presenting to my office that don't want to have a facelift. They'd like to have non-surgical options available to them that would help to reduce some of the signs of aging, but without causing the surgical scars and some of the changes that they would see with a facelift. What I'm going to talk about are different options available in regard to non-surgical facial rejuvenation. Medical grade skincare, the fillers, as well as Botox, as well as fat grafting and lasers. Those are the topics I'm going to be discussing. First of all, medical grade skincare. There are many different type of options available for the patient using medical grade skincare in order to improve the appearance of the skin with the use of medical grade products. First and foremost is Retin-A. That's been tried and true, and there's no question that Retin-A does work. It's an antioxidant. It helps to increase the collagen content of the skin, and it also helps to increase the blood flow, circulation, and help heal the skin. Other options for patients include different products that would help to maximize the effectiveness of Retin-A, as well as some of the growth factors and other vitamin products, vitamin C, niacin, and as I said with Retin-A, which is vitamin A products that help to rejuvenate and heal the skin. Second, the type of patient that I see desires some type of a filler, and patients who desire a filler are usually those patients that have lost some of the volume of their lips, have some aging around the crease line in the face, as well as some of the lines around the mouth. And the fillers that are used are usually based on products and substances that are found in youthful skin, one of which is what's called hyaluronic acid. Hyaluronic acid is a clear gelatinous substance that's found in youthful skin. If you look at the face of a young child, they have a beautiful, supple look to their skin, and what they have is a supple appearance of the collagen, as well as a nice firm base of the hyaluronic acid, as well as a fatty tissue substrate. And what we try to do is imitate what's found in youthful skin. Different fillers are used in the office to help to redefine and bring back something that was once found in youthful skin. And we do these type of fillers with a needle in the office, but first we always try to make patients comfortable as possible, and that includes putting numbing medicine on a patient's skin, as well as sometimes even injecting some numbing medicine around the areas that we're going to inject to make it as comfortable as possible. Botox is also a very popular substance that we use, and Botox is best used around the area of the eyebrows, as well as it can be brought up into the area around the mid-forehead and around the lateral aspect of the eyes. What Botox is a naturally occurring protein that temporarily blocks the ability of the nerve to talk to the muscle. And this protein eventually goes away. The body degrades it into non-toxic substances, so it's very safe. Botox needs to be injected with very skilled hands in order to give a very natural look. Over-injecting Botox can cause problems with drooping of the eyebrows, as well as an overdone, less animated face. So choosing the proper injector is very, very important in order to get natural results, and natural results would include a smoothness of the forehead and softening around the eyes. Fat grafting is becoming more and more popular in my practice. Fat grafting involves the use of taking tissue from the fatty deposits, usually in the abdomen. And I've never had anybody complain about taking fat from the abdomen. Most patients are very happy to have that removed. The fat is then subsequently taken by the use of certain type of needles and blunt-tipped special devised fat injection processes in which the fat is removed from the abdominal region and placed in a centrifuge. And the centrifuge then separates the fat from the local fluid, and so that the injection of the fat is very precise, that you're injecting fat into areas such as back into the cheeks, along the nasolabial fold, back into the lips. And one of the processes that occurs with aging is that we lose the natural fat in our cheeks. The cheeks start to settle and the fat becomes at a lower level instead of in a youthful higher level. And so with the process of fat injection, we're placing the fat back into a higher, more aesthetic, more youthful placement and giving volume back to what's lost with age. One of the benefits of fat injections, they're actually finding adult stem cells that are present in the fat that stay for a very long time. Fat injection is thought to have about 30 to 40% of the fat that's injected a permanent process. And since these fat cells have a long-term benefit, fat may last for years. Another option is lasers, and lasers are used to rejuvenate the superficial layer of the skin. It may be an ablative type of laser, and the ablative lasers actually require a little bit more of wound healing and are a little bit more painful. They require more anesthetic. The less invasive laser treatment involves the use of the light-based lasers, and you may have heard photofacial is a name applied to some of these lasers. The laser itself uses light, and you're tricking the body into forming collagen. Since collagen is broken up by aging process of the skin, what we're doing is tricking the body into forming collagen by heating the superficial layer of the skin while protecting the outer layer of the skin. And the process to do a laser involves the use of a topical or cream-based anesthetic, and after that the laser should be very comfortable. Most lasers require a very short-term healing process in which at most you'd feel a little bit of a reddened sunburn effect on your skin. Otherwise, some of the older lasers had more of an involved healing process, and these are still applicable for some patients, such as somebody who has bad acne scarring or deeper wrinkles. But for most patients that are interested in more of a rejuvenation of the face, to reduce some of the fine lines, to reduce some of the pigment on the skin, a laser is very, very useful. Lasers usually are used with several different type of programs. The program of the laser that I use requires 5 different treatments, each about a month apart, and the collagen that is produced with each laser tends to build upon itself so that you have a very long-term, several year lasting effectiveness of the process. Again, the type of lasers and Botox injectables should be performed by a board-certified plastic surgeon, and the best option is to consult the American Board of Plastic Surgery for a surgeon in your area. This is Dr. Elizabeth Harris, and I practice in San Antonio. My website is eharrismd.com, and my phone number is 210-545-4848. Thank you very much.